Good afternoon. I'm David BAYADA, the CEO here at BAYADA Home Healthcare. Today is Monday, April 20th, and this is your daily CEO update during the coronavirus pandemic. April is Autism Awareness Month, and many of you know that here at BAYADA, one of our 10 specialty practices, the types of service we provide, one of the 10 specialty practices is what we call our behavioral health practice. And this is teams that are focused on the provision of services primarily to children on the autism spectrum. And we have some incredibly amazing clinicians and team members that focus on this service. And we were lucky enough to be recognized on Hawaiian television. One of our clinical leaders in the behavioral health practice, Kristen Koba-Burdt, was interviewed as part of Autism Awareness Month, particularly related to some of the challenges because our services are often provided in the school system or in our center-based service model. And so I wanted to share this amazing footage of a news interview with Kristen out in Hawaii. Enjoy.
Welcome back. It is Autism Awareness Month. The CDC estimates that 1 in every 68 kids in the U.S. are diagnosed with autism. The numbers continue to rise, and during this pandemic, many families are struggling with meeting the special educational needs of their children. Joining us live from Haiku, Maui, Kristen Koba-Burdt, a licensed and board-certified behavioral analyst with BAYADA Home Healthcare Hawaii. Kristen, thanks for joining us.
Thanks so much for having me.
This is an issue that a lot of families are dealing with. When their children are out of school for this long, the hope is that they don't regress. What can families do if they're struggling?
Families can really look at some of the available resources online. Autism Speaks, as well as the Association for Science and Autism Treatment, in addition to many other organizations, have put out a lot of tips to help support families at home, whether that be in their daily routines, such as chores and brushing teeth and having breakfast, or participating in school enrichment activities. And so really giving some guidance to families to help structure the time at home.
And that is what Autism Awareness Month is all about. You mentioned one place they can go, and you also mentioned keeping routines, the daily routines up. Is that crucial to not survival, but getting through this when they don't have any other help?
Absolutely. I mean, when we think about how disruptive physical distancing and the significant changes have been for all of us, we can really sympathize with individuals with autism. So repetitive behaviors, difficulty with change in routines are some of the core symptoms of an individual with autism, and so really exacerbated by situations such as physical distancing and the significant changes in routine. So we really look at trying to support family members to keep a consistent schedule of activities. Obviously, daily life has been changed pretty significantly, but looking at what's happening within the home and building a schedule that the child and the family can really consistently implement. Many parents are working from home or have modified schedules. Some family members have also obviously siblings at home. And so really trying to adapt a schedule that's going to work well for the family and to support the child with autism, to have consistency and know what to expect within their day.
Last question here. Nutrition is a big deal. Of course, a lot of kids in Hawaii get their nutrition primarily from school. If you're at home, is there anything that you should be, whether it's vitamins or certain types of food that you should be feeding your child?
I think that's definitely a conversation with their physician. And so one of the comorbid conditions is that some children with autism suffer from GI issues and other, stomach kind of related issues. And so definitely talking to their doctor about any dietary restrictions or changes that should be in place.
All right, Kristen Koba-Burdt, we appreciate you stopping by from Haiku, Maui.
Thanks so much.